Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Today, we're talking about two of the most popular diabetes medications on the market, Jardiance and Farxiga, and a side effect so serious that the FDA issued its strongest warning. It involves a rare but aggressive infection that destroys soft tissue in the genital and perineal area, known as Fournier's gangrene. While extremely uncommon, recognizing the warning signs could save your life. Before we dive in, a quick note. This video is for educational purposes only. Do not stop any medication without speaking to your doctor. The benefits of these drugs are well established, but knowledge is power. In this video, we'll break down how these medications work, what the FDA warning really means, and the critical symptoms you need to watch for, so you can take control of your health. Segment 1. How Jardiance and Farxiga work. To understand the side effect, we first need to understand how these medications work. Jardiance and Farxiga belong to a class of drugs called SGLT2 inhibitors. SGLT2 stands for sodium glucose-linked transporter type 2. That is a mouthful, so let's break it down simply. Inside your kidneys, there are tiny filtering units called nephrons. Each nephron contains a protein called SGLT2, whose job is to reabsorb glucose from your urine back into your bloodstream. Normally, this is a helpful process. Your body wants to hold on to energy. But for people with type 2 diabetes, blood sugar levels run high, and the kidneys are working overtime to reabsorb that excess glucose. This is where SGLT2 inhibitors, like Jardiance and Farxiga, come in. These medications block that SGLT2 protein, preventing the kidneys from reabsorbing glucose. Instead, the excess glucose is flushed out of your body through your urine. This lowers your blood sugar levels without causing weight gain or the hypoglycemia risks associated with some other diabetes medications. But that is not all these drugs do. Research has shown that SGLT2 inhibitors also reduce blood pressure, protect kidney function, and lower the risk of hospitalization for heart failure. In fact, both Jardiance and Farxiga are now approved not only for type 2 diabetes, but also for heart failure and chronic kidney disease, even in patients without diabetes. Jardiance contains the active ingredient empagliflozin and comes in 10 and 25 mg tablets. Farxiga contains dapagliflozin and comes in 5 and 10 mg tablets. Both work the same way, are taken once daily, and are considered safe and effective, with real-world data showing similar cardiorenal benefits and safety outcomes. However, they are not without risks. Common side effects include urinary tract infections, genital fungal infections, increased urination, and nausea. And then there is the rare but serious condition at the center of today's video. Segment 2. The FDA warning in Fournier's gangrene. In August 2018, the U.S. Food and Drug Administration issued a drug safety communication that added a new warning to the prescribing information for all SGLT2 inhibitors, including Jardiance, Farxiga, and others like Invokana and Steglatro. The warning was about cases of a rare but life-threatening infection called necrotizing fasciitis of the perineum, more commonly known as Fournier's gangrene. Fournier's gangrene is a severe bacterial infection affecting the tissue beneath the skin in the genital and perineal area, the space between the genitals and the anus. It's a form of necrotizing fasciitis, meaning it spreads rapidly along connective tissue, cutting through the body beneath the surface. The infection typically begins when bacteria enter through a small cut, sore, or abscess. Once inside, they release toxins that destroy tissue and disrupt blood flow. As circulation is lost, the affected tissue begins to die. And this can happen quickly, sometimes within hours. Although the condition is extremely rare, its severity is what makes it so concerning. Between March 2013 and May 2018, the FDA identified 12 cases in patients taking SGLT2 inhibitors. 7 were men, but notably, 5 were women. Patients ranged from 38 to 78 years old, and symptoms developed anywhere from 1 week to over 2 years after starting the medication, with an average of about 9 months. All 12 patients required hospitalization and emergency surgery to remove infected tissue. Several needed multiple procedures, and some developed life-threatening complications, including diabetic ketoacidosis, kidney failure, and septic shock. 1 patient died. To put this in perspective, cases like this were extremely rare before these medications. Over more than 30 years, only a handful were reported with other diabetes drugs. and those cases were almost exclusively in men. With SGLT2 inhibitors, cases have occurred in both men and women. Even so, the overall risk remains very low. But because this infection is so aggressive and potentially life-threatening, the FDA determined that even a small number of cases warranted a formal warning. Segment 3. Warning signs and what to do. With Fournier's gangrene, early recognition and immediate medical care dramatically improve survival. If you take Jardiance, Farxiga, or any SGLT2 inhibitor, you need to know these symptoms. Early signs include severe pain in the genital or groin area that feels much worse than the skin looks. This is a key red flag. The pain can be out of proportion to what you see externally. Swelling, redness, or warmth in the genital or perineal area. Tenderness that makes the area sensitive to touch. Fever and chills, which indicate the infection is affecting your whole body. Fatigue, weakness, or a general feeling of being unwell. As the infection progresses, more alarming symptoms appear. Skin discoloration, turning purple, gray, or black as tissue begins to die. Blisters or open sores in the affected area. A crackling sensation under the skin, caused by gas produced by the bacteria. Foul-smelling discharge from the infected area. Rapid heart rate, confusion, or dizziness. Signs that the infection is spreading and your body is going into distress. If you experience any of these symptoms, especially if you have diabetes, seek emergency medical care immediately. Do not wait. Do not assume it will resolve on its own. And don't let embarrassment delay you. Fournier's gangrene progresses rapidly, and in this case, time truly is tissue. When you arrive, tell your healthcare provider that you're taking an SGLT2 inhibitor. That detail can speed up diagnosis and treatment. If the condition is suspected, doctors act fast, starting broad-spectrum IV antibiotics and performing emergency surgery to remove infected tissue, a process called debridement. Many patients require multiple procedures, along with intensive care support to stabilize the body. After the infection is controlled, reconstructive surgery may be needed to repair the damage. Again, this condition is extremely rare, but it's one where awareness makes all the difference. Recognizing the signs and acting quickly can quite literally save your life. Taking care of your health isn't just about medications. It's about understanding your body and making informed choices every day. If you want help building a healthier relationship with food and more stable blood sugar, we've created a free mindful eating guide for the Blood Sugar Squad community. You can download it using the QR code or the link in the description below. Segment 4. Final thoughts. So what's the takeaway? Don't be afraid of your medication. Drugs like Jardiance and Farxiga are powerful tools that help control blood sugar while protecting the heart and kidneys. For most people, the benefits far outweigh the risks, but knowledge is your best defense. Every medication has potential side effects. The goal isn't fear, it's awareness. When you know what to watch for, you can act quickly and protect yourself. If you take an SGLT2 inhibitor, pay attention to unusual pain, swelling, or skin changes in the genital or perineal area. And remember, there are other serious risks to be aware of as well, including diabetic ketoacidosis and severe urinary tract infections. Symptoms like nausea, vomiting, abdominal pain, confusion, unusual fatigue, or difficulty breathing should never be ignored. You are the most important member of your healthcare team. Know your medications, understand the warning signs, and trust your instincts. If something feels wrong, speak up and seek care. That awareness can make all the difference. What are your thoughts about Jardiance, Farxiga, or SGLT2 inhibitors? Comment below, and please share this video with someone who needs it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.